Roberta?
Sim.
Graham Navarra. Nice to meet you.
My name is Roberta Reis. I'm a psychologist. I work in this area about 7 years. Before working here, I was working mobile unit of Methadone program. After that, I came here. This service is named SAI, Serviço de Apoio Integrado. It's because we have not only the consumption rooms to smoke and to inject, but we have other services too. Like people can take shower here, can take bath, can do their laundry, or can have small meals, because about 41% of the population that comes here is living on the streets. People have to bring the drug with them. We give the space and all the material and all the technicians that work here, like social workers, like psychologists, nurse, a doctor. They can have appointments with the doctor once a week. A psychiatry that is here too. The median of age, it's about 43 years old. We have more men than women. We have 86% of the population is men, and many of them are in a very disorganized situation, without living on the streets, without link with any service like social service or health service. So it's our job too and our goal to link people to the service, and try to see what they need and try to link them with their needs.
How do people living on the streets become aware of the service? Do you also provide any outreach?
We have a community team that goes to streets every day, and before the space open, 1 month before, the team goes to streets every day and talk to the persons, to the people who are using on the streets, and talk about the service. And when we open, they came here, and right now I think we have about 266 people here on this space.
206 service users currently.
Yes.
Okay, and is there like a maximum capacity that you would have, or would you expect this to continue to expand?
Yes, I expect it to continue to receive people, but at the same time, in the consumption room, the law only allows us to have 10 people at the same time. So this is kind of a little bit difficult for us, because we have more people that smoke than inject. We have more than 80% of the people that come here smoke.
80? The majority, like 8 out of 10?
Yes,
okay.
Yes, the majority smoke. So our smoke room is not so big, so sometimes it's a little bit difficult to control this. Yeah.
Are there any special programs or means to incorporate more females into the service? Like anything in specifically to try and get more of a diverse
females?
Audience?
Not yet. But normally people who use drugs, normally we have more men than females.
Yeah.
So we are trying to get to all of them, and try to talk about the space, and try to bring them to consume here. It's a work that we have to do, because many of people that use drugs use for a long time, about 20 years. So they are used to consume in their way. So it's a work that you have to develop with them and try to explain why this space is so important to them, because it's safer than use on street. Because many people using place very dirty or very unsafe, like nearby the train. So it's important to have a safe place in all ways to consume.
What kind of drug trends do you see? Mostly smoking. What kind of drugs are normally smoked?
Cocaine, crack,
See.
and heroin.
See.
Yes.
Is there a lot of methamphetamine use?
No.
Okay.
No. It's the most of people, the majority of the people that come here use these drugs. We have a little bit of the population that come here that use benzodiazepines, but it's very low when we compare to these drugs.
And since 2001, drug decriminalization has been introduced, and this service has been permitted to be used since 20 years ago. Why do you think it's only now that the service has opened?
Yes, it's a good question because in that time we saw many teams of harm reduction here in Lisbon, like the methadone programs, like the teams that go on the streets, but we not able to achieve all the population that use. So this space is so important because of this, because we cannot achieve all the population that use drugs. It was very important. All the structure that came after the decriminalization, but we miss this space. Yes.
Is this going to? Am I correct in understanding that this is a pilot for now, and for 1 year?
Yes.
This will be measured.
1 year and more one, and after that, after 1 year, it will be evaluated, and it's more 1 year, and after that, it will be evaluated again.
What kind of results do you hope to expect in 1 year from now?
We expect more people consume here inside, less trash of the consumption on the streets, because we do this work too, to take the trash of the consumption. We take off the streets, and we hope that people that comes here have a safer have a safe way to use drugs, and know more about their body, know more about the way to use drugs, and reduce all this infection disease, because it's very important to do tests with these populations, HIV, hepatitis, syphilis, and we are planning to start doing these tests next week. So it's important to link people to the services. We are trying to create relations with persons who comes here.
Yeah, and it's okay?
Yes,
yeah.
Yes, because many of people that comes here don't do tests for a long time, so they don't know how they are. So we try to create this relationship, and it will not be a thing that they must to do, but it's a thing that we want to educate them that it's important to their health, and to know how they are.
Could you describe an average day for you in working on this project?
Okay. I can say one word, that it's very intense. We have a very close relationship with people who comes here, because in some way to them to use this space they have to trust in us. We have to create this connection, so it can help in many things during a day. One day it's never equal to the other. We have many things happening, but most of the time I can tell you that it's a very pacific environment. So yes, but it can happen many different things. The person comes here for the first time. We introduce the space to them. Try to say to them what they can get from this space. So if they don't want to use the space in the first time, they can only see the space and try to adapt to the space, and in the next time they can be more comfortable to use. But right now we have many people that comes here every day, about 70 people that comes here every day to use both rooms. So I think they already getting used to the space. In the first week, the most of the people that come here, the people that use this space in another country, for example, had already had this experience in another country, so they know more about the consumption rooms, and they give us many tips, and they can bring us different suggestions that how can we improve the space, what can we do to improve the space, that is for them, it's not for us, it's for them. So we always ask them what they think about, how can we improve something.
How many people are on your team currently at the moment?
In the team we have about 20 people, counting with the nurse team. It's not too much people, but we are trying to get in more. Yeah.
Is it difficult to find people to work in this area in your profession of psychology or public health?
Sometimes people don't want to work in this area, or sometimes it's difficult to find people that have the experience in this area. So part of the team do not have the experience before, but now are building this experience, and I think it's very rich because they bring us different things. But sometimes it can be a little bit hard, yeah.
What would be the biggest challenges that you've seen so far in the first month?
In the first month, I think the limitation of the space, the smoke room, it's not so big. So I think it's the biggest challenge, because we have more people that smoke. In the beginning, we don't think we have so many people to smoke. So the limitation of the space maybe the biggest challenge so far. But I understand that we have much more challenges.
So if you were to start again, maybe you would have built a larger smoking area.
Yes. We try to make a space that they can stay a little bit, that they can talk a little bit with us, they can do games, they can use internet, they can read books, they can watch TV. this space and eat something if they want, but the consumption rooms are the other side.
It's become safer now for children,
Yes, it's safer now for children, yes.
and parents understand this more.
Yes,
Yeah,
yes.
but only after you opened.
Yes.
You had to demonstrate by showing.
In the process to opening the room, yes.
Okay.
And